see me, but when you guys are doing this, you're going to do it with gown and glove on.
Please don't.
So again, like I said, you can follow along in your book.
Okay, everybody get your cameras out.
Page 21 and 22. Also, you'll have to memorize the way the instruments are counted. And those count sheets are in your book on pages 14 through 17. So when I'm doing the counts, follow along in there, and you can see how the count orientation goes. So we're started off here with everything is open. When we go through this exercise, I'm going to have you practice opening everything. But for now, we're going to start off with everything open. Even before I scrub in, there's this basin set that's on top of this sterile pack that's here. I can grab that off just by grabbing it and stepping back and setting it in a ring stand and opening it over here. A lot of my extras are in this pack. Open this, and once these are open, I can push them right up against my gowning table. It helps to create a continuous sterile field that eliminates the chance that you're going to step between two sterile fields. Then I'm going to go out and I'm going to scrub, and I'm going to come in with all my PPE, my mask and my eye protection. I'm going to be scrubbed, I'm going to gown, my circulator is going to tie me up, put my gloves on, turn my gown, and get ready to go. Step number one, and this will follow along with your St. Mary's setup as well. Step number one is organizing your gown table. These gowns, linen gowns come in a stack. The top layer is a gown and a towel. Then there's a barrier drape, a linen Mayo stand cover, which you're going to have to get used to. It feels a little different putting it on than the paper plastic one at St. Mary's. And then another stack of another 4 gowns. And a whole bunch of towels. So I'm going to start organizing this. I'm going to put my towels in the back left corner. I'm sorry, my gowns in the back left corner. Separating out my barrier drape and my Mayo stand cover. I'm just going to set those back here for the time being. Set some towels right there. My next goal is to get myself counted with instruments. So in order to count instruments, I can slide these together too. Again, it creates a less distance to walk between the tables, and it eliminates the chance that anybody's going to try to step between my sterile fields. So I'm going to come over here. This is a procedure drape and some extras that come in the pack. I'm just going to fold this up and set it over here in the space that I've made for now. First thing, before I put any instruments on the table, I'm going to need some towels. I'm going to tell you right off the top of my head that I'm going to need 6 towels over here. So just go ahead and grab 6 towels right away, and they won't you won't have to make extra trips. So set my towels there. Put 1 towel on the end of the table for my working area, and then make a roll towel for my instruments by laying 2 towels down and rolling them up. I'm going to set this a few inches from the back of the back table because I'm going to use that back space to organize some of my retractors. Now I have 3 pans. The Major 1 pan has ringed instruments like clamps and scissors, as well as towel clips and knife handles. Major 2 is your retractors and pickups, and the long instrument pan, which is over there, is like it sounds. It's ringed instruments and pickups, but they're longer. They're for deep abdominal procedures. The best way I've found to do this is to start with your Major 2 pan. Set that right in the upper corner there. That's where it's going to go. I've picked it up. I've placed it in one motion in one spot, so I don't have to move it again. I'm not going to duplicate movements here. Your long instrument pan. Thank you. I'm going to actually just empty out the pan. There's just 2 racks of instruments and a pair of long pickups. So I'm just going to set those here in front of my Major 2 pan. Then I can pass this empty pan off to my circulator or set it on the bed. Same thing with the Major 1 pan. I'm going to arrange the instruments so that the shortest clamps, the mosquitoes, are toward my working area, which is where the towel is. And just arrange them in order of length from shortest to longest. I'm going to take out my rack of towel clips and put it right above the towel, right above my roll towel there. And don't forget to grab out your knife handles. It's something that's real easy to forget. Knife handles will go right there, and then you can pass this empty pan off as well. Now in order to get ready to count, I'm still thinking in my head, my goal is to get counted. I need to organize my instruments for the count. So major 1 pan is pretty well organized, there's not much I have to do to it. Long instrument pan is also ready to go, but my retractor pan and pickups, the major 2, needs work. It's just a mess of retractors and everything. So because I know the order that these are counted in, because I studied and memorized my count sheets, it's going to make counting a lot easier because I'm going to count them in the order that they are on the sheets. That helps my circulator because they don't have to hunt around for the instruments as I'm describing them. Stick the Balfour up on the side. There's a couple of suctions in here. You want to make sure with the yank hour suction that this metal tip on the end is tightened on there. It should be loose when it comes up in the pan or disconnected completely. That makes sure the steam penetrates it completely for sterilization. There's also a pool suction. There's one of these little Zimmer blue clips. If you read the count sheet, you'll see there's supposed to be 2. There's one missing from this pan. That's okay because it's an exercise in how to count if there's a discrepancy in what's in the pan. Just make sure you point it out to your circulator when you're doing your count. Now that my retractors are all set up, I'm going to put my pickups on the side of the pan. This is one of these things where there's no right or wrong way to do it, as long as you can give a reason and justify why you've done it a certain way. And as soon as I get them set up here, I will explain my justification for my way. I'm not telling you you have to do it this way. There's a probe in here as well. You can slide that under your roll towel right next to your suctions. And then you have this extra fabric you can just toss off. My justification for doing it this way is this. The Adsons with teeth and the Ferris-Smith's forceps are your closing forceps. You're probably not going to need them till the end of the case, but when you do need them, you want them front and center, you want them easily accessible. Likewise, the DeBakey forceps are also a commonly used forceps even during a case, so I have those on the side of the pan closest to me. If you're doing an intra-abdominal procedure and the surgeon does want a toothed forceps, it's most likely going to be a Stili with teeth. So I've got the Stilis on the same side as the DeBakeys. But take note that I have them physically separated, and I have the Stilis, actually the handle pointing the other way. The reason that's important is I don't want to confuse the two because they're about the same length. And if the surgeon asks me for a DeBakey, that means that they're operating on what kind of tissue? Soft, delicate tissue, and they definitely do not want a forceps that has a tooth on the end like a Stili. So you don't want to mix up the two. You want to have them physically separated so you don't accidentally hand the wrong forceps and cause trauma to the patient's tissues. So that's why I set these up this way. The Singly and the Russian forceps are uncommonly used, but I still have them set up and organized, A, for my count, B, so I know where they are, but they're on the opposite side of the pan because I know I'm not likely to need to use them very often. So at this point, once I'm to this level, I'm ready to count, and I can go through my count sheet. Where did those end up? The ones in the pans.
Underneath your...
Okay, yeah, they're over there. I would go through the count with my circulator, and this is how I'm going to count with them. I'm going to call out the name of the instrument before I count them and let them know how many of each type of instrument there is. So I'm going to say I have a rack of towel clips. So this is you can follow along on your sheets if you want. This is the order they go in. This is how I expect you to be able to count them. Towel clips, 2, 4, 6, 8, 10. You just count them as a total of towel clips, even though there's 2 different kinds of towel clips. You can see here there's penetrating and non-penetrating towel clips on there. But just go ahead and count them as a total. Then you can use a knife handle to assist you in counting the rest of them. Curved mosquitoes, 2, 4, 6. Kellys, 2, 4, 6. Coker Oshner's, 2, 4, 6, 8. Oops, 8. Carmelts, 2. Alice's, 2, 4, 6. Babcocks, 2, 4. 6-inch peons, 2, 4, 6. Tonsils, 2, 4, 6. So these are not supposed to be separated. 8, 10, 12, 14, 16. There's 16 tonsils. Even though some of these may look, or collars, whatever you want to call them, they may look slightly different. That's just difference in manufacturers. So these are considered 16 collars or tonsils. Westfalls, 2. Then there's 2 different right angles. They're listed as 2 separate instruments in the count. You can count them as a Kantrowitz or a Rummel thoracic right angle, or you can just say I have 2 right angles, or you can say right angles 1 and 1 is usually how I'll do it. 8-inch peons, 2, 4, 6, 8. The next group is scissors, and this is another one where even though there's different types of scissors, you can count them as a group of scissors. So 2, 4, 6, 8 scissors. 2, 4, 6, 8 scissors. Then the next group is needle drivers, and it's the same way with the needle drivers. You can count them as a group. 2, 4, 6, 8, 9. They're supposed to be 10. 2, 4, 6, 8, 10. Somebody must be goofing with me. Somebody walk off with a... Empty your pockets, everybody. 10, anyway, there's 10 needle drivers, and then 2 sponge sticks. The last item on the count is knife handles, 1, 2, 3, 4. So major 1 is pretty straightforward and easy to count. It starts with the towel clips and then just goes right to left through your major 1 instruments. The major 2 is a little more difficult to count because it doesn't go, there's no order of the instruments that the way they come in the pan. So you just, unfortunately, just sort of have to memorize the order. But it starts off with the balfour. And with the balfour, we need to count that it's a balfour and that it has a wing nut. When you get to UW, different sets will have different types of balfours. Some of them will have 2 wing nuts. Some of them will have removable screws at the end. So in this case, I'm going to count this as 1 balfour with 1 wing nut and 0 screws. There are little nuts on the end, but they're not removable. They're welded in place, so they're not considered a separate screw. After the balfour comes the ribbon malleable retractors. There are 3. You just sort of hold them up, or you can count them 1, 2, 3. Next is the devers. There are 6 devers. 1, 2, 3, 4, 5, 6. Then there's the balfour center blade, 2 body wall retractors, 2 Richardsons, 2 appendiceals. Now I'm going to move over here to my small handheld retractors that I put behind my roll towel. 2 Army Navies, 2 rakes, 2 cheeks, 2 greens, 2 cheeks, 2 vanes, pushing vanes, whatever you want to call them. Then the suction tips, and you have to count them and all of their parts. So you can say I have 2 suction tips with 2 pieces each, because there's a tip on the Yankauer and then the long tip on the pool. The Zimmer blue clip, again, I have 1. The count sheet says 2, so make sure that if there's any discrepancy in what's supposed to be there, both you and the circulator are on the same page as that. I only got 1 blue clip. Then forceps. Forceps are another thing that even though there's different types of forceps, you can count as a total group. There are 14 of them, so you can go 2, 4, 6, 8, 10, 12, 14 forceps. And the last item is the probe on the count sheet. The long instrument pan is counted. There are 2 separate racks, and you just count them as a total on the rack, but the racks are slightly different, so you want to let your circulator know which rack you're counting. Maybe I don't know which one is called rack 1 and which one is called rack 2, but I know this rack has some Alice's and some Babcocks and some clip appliers on it. So you can even say to your circulator, I've got the rack with the Alice's and the clip appliers on it, and there's 2, 4, 6, 8. And then the other rack has the peons and the scissors and the right angles. You can go, again, as a total, 2, 4, 6, 8, 10. So there's 8 on one rack and 10 on the other. And then make sure you count the 2 long forceps as well. So that's instrument count for UW setup. Now my next goal is to get to a point where I can count extras. Maybe the circulator is going to leave now and go pick up the patient, or the circulator is going to go get some positioning equipment or something else, some drugs from the pharmacy or something. I have a few minutes here. The Mayo stand, it's the same concept as putting on the plastic and paper one over there, only since it's not plastic and paper, it's fabric, it has less memory, which in some cases is good having less memory, but in this case it kind of works against you, because what's going to try to happen here as you put this on and push it forward, this part is going to slide off and fall down and hit my feet, which obviously would be a contamination. So I want to keep it up on the Mayo stand somehow. You can use your tummy. So just sort of scoot it on there. I've got my body up against it here to keep it from falling on the floor. Once it gets all the way on there, you can tuck the extra fabric in under the tray of the Mayo stand and you're good to go. If I have free ties, or I'm going to load ties on passers, I would put them on the Mayo stand now, but I don't have them, so I'm just going to put my towels down. Put one towel over the Mayo stand like that. The second towel goes offset just a little bit. And this way, if you do have free ties, you want to load ties on passers, you have a little pocket you can stick your passer, your tonsil or your Kelly or whatever you're using as a passer under there. My sixth towel, I'm going to make a little roll towel for the Mayo stand just by rolling a towel into quarters and rolling it up a little bit. Okay, now I'm going to bring over my extras and get those ready to count. So, rectangle basin goes there. Bless you.
Thank you.
Magnet pad goes here. We're not going to open the blades, although if we were really doing the setup, we would open the blades to confirm that there's one blade per package when we do our counts, and we will load them on our knife handles. But for this exercise, we'll just count them in our needle magnet thusly. A little ruler can go underneath your needle magnet. Extra bovie tip, the long bovie tip, and the sheavers can go right next to your needle magnet for counting purposes. There's a skin marker in here. I'm just going to go ahead and set on my Mayo stand. It's not countable, but I know that's where it's going to be, so I'm going to set it there so it's easily accessible. And for counting purposes, the bovie scratch pad as well. You can organize these little cups in your basin there if you want. The knife handles and the suction and the bovie can come up. As long as I'm touching it, I'm going to go ahead and put the suction tip on my suction tubing. Get those ready to go, ready to count. I've got some laps and some 4x8s. My irrigation basin here, I've got my clear plastic pitcher and my asepto syringe will go in there. My round basin can go right there. Now I'm ready to count extras. So I can count blades. Well, we always start with blades, bovie tip, scratch pad in that order. So we'll go blades, 1, 2, 3. Bovie tips, 1, 2. Make sure your circulator can see it. Scratch pad, 1. Sheavers, 1, 2, 3, 4, 5. Counting each one aloud, making sure the circulator can see them. Then I can count my sponges. I've got one pack of 4x8s, so I'm going to go 1, messed up, so I'm starting over. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And laps, the same. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now we're all counted. I can start getting ready for having my Mayo stand ready. I'm going to put my 4x8s up here. Sometimes we'll start with 4x8s on the Mayos, sometimes we'll start with laps, but and either way would be correct, but in this case I'm going to start with some 4x8s up there. Need to take the stringers off my instruments now so I can grab them. And just like in the St. Mary's setup, I'm going to need some instruments from each category of instruments. So you don't need a whole lot to start a case, even a bowel case on your Mayo stand. I'm going to suggest that you start with 2 mosquitoes, make sure they're clicked once, 2 cokers, 2 tonsils, and at UW they love to dissect with Westfalls, so I'm going to put 2 Westfalls up too. If you organize them on your Mayo stand like this, with the curves of the instruments pointing in opposite directions, they will be less likely to tip over. There are other ways that you see some people do this, where they'll put a towel clip in here so they can lean their instruments against it, or they'll stick their sheavers on this roll towel so they have something to lean it against. There's a lot of right ways to do that, but this is one way. So I've got clamps. I want to move on to cutters. Make sure I have something of each category up there. I want to be able to cut delicate tissue, tough tissue, and suture. So I'm going to start with my 3 regular length scissors up here. A Metz, a curved Mayo, and a straight Mayo. I'm not going to worry too much about long instruments yet. I can switch over to those once we open the abdominal cavity. So I'll put a couple of short DeBakey's. And in case they want something with teeth, I'll put some short stillies up there too. So now I've got clamps, I've got cutters, I've got forceps, I need retractors. Good retractors to start with. And again, you could argue with me on this and you'd probably be right. But a pair of Army Navies and a pair of Greens are good starting retractors for making a skin incision, for retracting the soft tissue before you enter the abdominal cavity. Once I've got that stuff set up, I can bring up my suction tip and my Bovie and my light handles and my scratch pad and have everything up here ready to go so that when I pull my Mayo stand up, I can pass those cords and tubings off. And we're all ready to go. One last thing before we start, I'm going to get my drapes ready. So I have my procedure drape. I have a linen barrier drape. You can just set up with one of those for the UW setup, and then I'm going to do my towels. So I'm going to open 4 landscaping towels the way we showed in class earlier. Partially fold it over. And I forgot towel clips. Slows me down just a little bit, but I'm just going to go grab 4 towel clips and bring them over and set them next to the draping. Now we're all set to go. When the surgeons come in, I have my gowns ready for them, ready to start draping, ready to pull up my Mayo and start the case once the patient is draped. Does anybody have any questions? Okay, you can stop your recording devices at this time.